Hello guys, welcome back to the channel. This is Side Dental Vlogs and you all are welcome to yet another vlog. And last video I made on pregnancy, whether you can do a RCT procedure in pregnancy or not. And I got many queries about impaction. Yes, third molars. Can we do third molar extraction or disimpaction in pregnant females? When shall we do it? So let's start with the video. So first of all, what happens is usually impacted tooth comes out around the age of 18 to 27. ये सब हम लोग जानते हैं, we know it very clearly. And usually young girls get married between 25 to 30 years. So usually what happens is whenever a patient who is pregnant plus she has got a pericorneal infection and pericornitis, so the situation becomes very grave. And that time patient doesn't know what to do, doctor also gets confused. So in the first trimester of pregnancy, what I usually do, that is my protocol. What I do, I never do any kind of extraction in first trimester of pregnancy, because the first trimester of pregnancy is very important for the patient because the fetus is growing. And during that time, any kind of medications or any kind of surgical procedure may lead to some complications. And by chance, if the tooth extractions become traumatic, it will be a lot of stress to the patient. So usually I do extractions in the second trimester of pregnancy. Yes, if it's an easy one, if it is a upper 1/8 or a 3/8 which can be easily removed, I judge after taking the radiograph. So I usually do mesoangular impactions, not that much impacted, or normal extraction in the first trimester. But usually I avoid surgeries in the first trimester of pregnancies. So what you can do, so if you can see a perigonal flap is inflamed and the third molar is infected, so you can give antibiotics and analgesics to the patients. Now, what kind of antibiotics you can give? You can give amoxicillin 500 mg plain. You can give to the patient. Along with that, you can give some lactobacillus to the patient. In the form of painkiller, you can give Dolo 650, which is very beneficial for uh, reducing the pain. Because if you give NSAIDs, so that is, you already know that NSAIDs are not good for not good for pregnant females, because it inhibits the prostaglandin synthesis, which is required during the growth of the fetus. So give Dolo 650. You can give very freely. You can even give 1 gram Dolo, but I usually prefer 650 mg medicine 2 times a day. Even if you give one dose, it gives a lot of pain relief. Nowadays, even doctors in hospitals for pain relief they are giving Dolo 650 instead of Tramadol. So the effectiveness is very nice because it doesn't cause that much gastric irritation. So along with that, you go through a surgery as well as you go through a gastric irritation. If I give you a NSAID, it's too difficult. So sometimes you can see if it's a lower third molar, so what you can do, if you have a cautery, you can just take out the pericorneal inflammation which is there around the 3/8, or you can also um, remove the pericorneal flap using a BP blade. So that way, what you will do, you remove the infectious tissue, and you will also remove the flap where the trauma was happening again and again. So the upper tooth is hitting the pericorneal area, and again the swelling will be there. So in the second trimester, what I do, I take a single radiograph using a lead apron to the patient, and after using the radiograph, taking the radiograph, we decide whether the surgery can be performed or not. Is it too complicated? Then we call a oral surgeon and we do together. Or if I do it single handedly, then I make sure that I don't give any other appointment on the same day, or just first, usually the pregnant females will be very like anxious, so you have to first pacify them and tell them it is going to be a total painless procedure. There should not be any pain, mind it, because if the pain comes, the stress will come. The patient may get some kind of pain or stress, so that stress is not good for a pregnant lady, right? So in the second trimester, we usually extract it until and unless it's really bothering the patient. If we see that by just giving medications it can be postponed for a few months, then we postpone it. Otherwise, we do the extraction. So in the third trimester, I have done RCTs. I have till now I have done only one upper eight extraction, one or four extractions. Usually, I defer for doing impactions in the third trimester. First of all, the patients, because of the pregnancy, the stomach will be a little bit swollen, and the patient won't be able to sit properly while doing the impaction. But if you break a root, it will be a longer procedure and it may cause some kind of labor pain. So usually we defer doing any kind of impactions until and unless it is very emergency, it's really required. Then only we do during the third trimester, and we tell the patient to wait for few more days, give amoxicillin and Dolo 650 as usual. That will reduce the pain and infection. And after the delivery, we call the patient on a just on a hourly basis, and we do the impaction and leave the patient, because once the baby is out then at that time there won't be any problem. So we have to be very cautious about the drugs what we give in the pregnancy, because apart from amoxicillin I don't give anything, not amoxicillin and clavulanic, only plain amoxicillin 500 mg, like many are available in the market like Novamox or Novamox LB. And do tell the patient to take some amount of curd, because the amoxicillin causes some kind of diarrhea to the patient, and that is really annoying by going to the bathroom again and again just because of the antibiotics with that pregnancy. So at that time we do the surgeries only if it is required, and only if it is very very much necessary. So I hope you like this video. If you don't follow me on Instagram, please do follow in Sai underscore dental. And sooner, I am going to be live both in YouTube and Instagram. Till now, the date is not decided. And love you all. Have a very great day and a very great evening. Thank you.